Denver Health is getting into housing these days. It's because some of their patients end up living at the hospital month after month because they have nowhere else to go. Our Nusha Roy explains how the real impact of what's happening here is just the idea of hospitals getting into housing.
Denver Health says one patient occupied a bed for more than 4 years. Another needed 8 weeks of at-home IV antibiotics, but had no home. A third with dementia came to the hospital after being released from jail because his family didn't want to take him. It's a problem the Denver Housing Authority wasn't really aware of until they started talking to Denver Health. Now they're turning this vacant Denver Health office building on Broadway into affordable housing, including 15 studios for patients who can keep up their treatment without occupying a hospital bed.
It's a way to kind of solve two problems: permanent affordable housing, but also some shorter-term housing options for people who need it.
If you think 15 studios for chronic homeless patients doesn't sound like enough, you're right. It's not. In the first half of this year, Denver Health had 100 long-term patients, and Denver Housing Authority said in a perfect world there would be many more units.
I am sure it's, maybe in the thousands.
Then there's the question of what happens after. The patients will work with the Housing Authority to find a permanent home, but can stay in the studio until that happens. And of course, there's an affordable housing shortage in Denver, and the city hopes to build 6,000 more units over the next 5 years.
And unfortunately, the affordable housing work that we're doing seems to be a drop in the bucket often.
But both organizations know something needs to be done and found promise in this idea.
I think 655 is a model that can be scaled up, and it shows that there is a solution that's feasible.
So Denver Health said that legally and morally it can't discharge a patient if they don't have a safe place to go, and that's what's going to keep happening until these new units, and they're not opening up until 2021. Sometimes those hospitals can work with private landlords to help with housing, but that is first come first serve with some pretty obvious challenges with that, Kyle.
I mean, talk about obvious, Anusha. If they are unable to discharge somebody who doesn't have a safe place to go, you can imagine that the costs would rack up astronomically when people just kind of get stuck at the hospital.
Yeah, so Denver Health was saying that it costs roughly $2,700 a day to keep somebody in one of their hospital beds versus the rent for one of these units, which will be anywhere between $600–700 a month. But the city says if a patient can't afford it, they're going to step in to cover those costs as well. So big difference there.
Wow. Now how to scale it from 15 to a couple of thousand.
Exactly.
Yeah. All right. Thank you, Nusha.